Hey everyone, and welcome to another deep dive. This time we're taking a look at botulism, and I know you guys are interested in this one because you sent in a ton of sources.
Oh yeah, definitely a popular topic.
And I think most people, they know the basics, like, watch out for bulging cans.
Right.
But today we're going beyond those cautionary tales.
Yeah, I'm kidding.
We're digging a little deeper. So really, what is botulism and what are some of the risks maybe people haven't heard about?
It's funny you mentioned the bulging cans.
Yeah.
Because that's sort of our first intro, right?
Oh, right.
To this illness. So let's back up a little bit and just sort of unpack what botulism is. It's a serious illness that's caused by a toxin that's produced by a bacteria called Clostridium botulinum. And this toxin is one of the most potent toxins that we know of. It attacks the nervous system and can lead to paralysis.
Oh, wow.
Which can be fatal.
Okay, so this is really serious stuff.
Very serious.
This is not just like, you ate some bad beans and got an upset stomach.
Definitely not.
This is like the real deal.
It is.
Okay. But you mentioned that bulging cans are only part of the story.
Exactly.
So I'm really curious to learn more about these other risks that maybe people aren't as familiar with.
Well, the good news is it's not just bad canning practices.
Okay.
There are actually 5 different types of botulism.
Wow.
And they come from a surprising range of sources. So we can start with the one that everyone's most familiar with, and that is foodborne botulism. And this is often linked to improperly home canned foods.
Okay.
Bulging cans are a red flag.
Yeah.
But it's not the only way that contaminated food can cause botulism.
So beyond those, scary jars in the back of grandma's pantry.
Exactly.
What are some of the other ways that people can actually get botulism?
So let's talk about infant botulism.
Okay.
This is actually the most common type.
Oh, really?
Here in the U.S.
Wow.
And this happens when babies ingest spores of the bacteria C, botulinum. And the spores then germinate and produce the toxin in the baby's gut. And you're ready for a surprising fact.
Always.
Honey is a common source of these stores and can be dangerous for infants under 12 months.
Honey.
Honey.
I never would thought something so seemingly harmless could cause such a serious illness.
It's a reminder that even natural products can pose risks.
Yeah.
Especially for vulnerable populations like infants.
Okay.
So moving on, we have wound botulism.
Okay.
This is less common, but still a concern. This happens when a wound becomes infected with the C. botulinum bacteria.
Okay.
And this is often associated with injection drug use.
Oh, right.
Where contaminated needles can introduce the bacteria directly into the bloodstream.
That makes sense. So it's not just what you eat, it's also what, can get into your system through wounds.
Exactly.
Are there any other surprising ways that people can get botulism?
There are 2 more.
Really?
That people might not be as familiar with. One is iatrogenic botulism.
Okay.
And this is a rare complication of medical procedures.
Oh.
That can happen if the botulinum toxin is accidentally injected in too high a dose.
So the Botox injections we hear about,
Yes.
for cosmetic procedures,
Yes.
those are actually using the same toxin.
It's the same toxin.
That causes botulism.
It is.
Wow. That's a little unsettling, but it also makes sense that there's like this fine line.
Yeah, it's a very fine line.
Between, therapeutic use
Right.
and potential harm.
It's all about dosage and careful administration.
Yeah.
And then finally, there's adult intestinal toxemia,
Okay.
which is similar to infant botulism, but it occurs in adults.
Okay.
This is usually linked to changes in gut bacteria,
How interesting.
particularly in people with underlying health conditions that affect their gut microbiome.
It's amazing how each type of botulism is tied to a different way the toxin's getting into the body, whether it's food, wounds, or even medical procedures.
Right.
It's amazing how diverse these sources can be.
Definitely.
But with all these different types, are the symptoms relatively similar?
Yeah, there are some core symptoms that are pretty consistent across the different types.
Sure.
But there can be subtle variations depending on how the toxin was acquired.
Oh, okay.
But it's important to recognize these symptoms early on because early intervention can be life-saving.
So what should people be on the lookout for? What are some red flags that might indicate botulism?
So some classic symptoms include drooping eyelids, blurred or double vision, slurred speech, difficulty swallowing, and muscle weakness.
Wow.
In infants, you might notice a floppy appearance due to muscle weakness.
Okay.
And these are all signs of the toxin affecting the nervous system. And maybe the most concerning symptom is difficulty breathing, which can rapidly progress to respiratory failure.
Those are some serious symptoms.
Very serious.
It seems like botulism can progress very quickly.
Can.
So let's say someone starts experiencing some of these symptoms. What should they do? How is botulism diagnosed and treated?
Well, if you suspect botulism, it's absolutely critical to seek medical attention immediately. Don't wait to see if it gets better on its own. Doctors will take a detailed medical history, looking for potential exposures, and perform a thorough physical exam.
Okay.
And they'll also run lab tests to confirm the diagnosis, such as blood tests, stool tests, or even food analysis.
Okay, so they're looking for evidence of the toxin itself in the body.
Exactly. And there's even a specialized test called the mouse neutralization test,
Wow.
which can definitively confirm the presence of botulinum toxin in a sample.
That's fascinating.
Yeah, and once botulism is confirmed, treatment usually involves an antitoxin, which helps to neutralize the toxin that's circulating in the bloodstream.
Okay, so the antitoxin can stop the toxin from doing further damage.
Correct.
But what about the damage that's already been done? Can it reverse the effects of the paralysis?
So, unfortunately, the antitoxin cannot reverse existing nerve damage.
Okay.
That's why early intervention is so crucial.
Yeah.
However, it can prevent further damage and give the body time to recover. Along with the antitoxin, supportive care is essential, especially if breathing is affected. This might involve mechanical ventilation to help the patient breathe.
Okay.
And for infant botulism, there's a specific treatment called botulism immune globulin, or baby big,
Okay.
which can be very effective at reducing the severity and duration of the illness.
It sounds like treatment is very specialized.
It is.
And the sooner it's administered, the better the outcome.
Absolutely.
So we've talked about the types of botulism, the symptoms, the treatment, but are there any common misconceptions about botulism that we should address?
Oh, absolutely. There are many myths,
Okay.
and debunking these myths is crucial for staying safe.
All right, let's dive into these myths and set the record straight. What's the first one we should tackle?
One of the biggest misconceptions is that botulism only comes from canned food.
Oh, okay.
While contaminated canned goods are a significant risk factor for foodborne botulism.
Right.
Remember that wound botulism comes from infected wounds, and infant botulism can come from sources like honey.
Right.
And as we discussed, certain fish products can also be a source of the toxin.
Wait, fish too? I thought the botulism risk with fish was mainly associated with sushi.
Sushi can be a concern, especially if it's homemade sushi.
Okay.
But it's not the only risk factor with fish. C. botulinum can actually thrive in low oxygen environments,
Oh, wow.
even at relatively low temperatures,
Okay.
which makes certain fish products more susceptible to contamination.
So it's not just about avoiding dented cans.
Right.
There's a whole other dimension to consider with fish.
There is.
What are some things that listeners should keep in mind to stay safe?
When it comes to fish, cooking it thoroughly to an internal temperature of at least 158 degrees Fahrenheit is crucial to destroy any potential toxins.
Okay.
Proper refrigeration below 39 degrees Fahrenheit is also essential to slow down bacterial growth.
Okay.
But you really want to be careful with vacuum-packed fish products.
Okay.
If you see any signs of spoilage or if the product's past its expiration date, it's best to err on the side of caution and toss it out.
So we need to be smart about fish, especially the prepackaged stuff.
Definitely.
What are some other myths that often pop up?
Another common misconception is that refrigeration prevents botulism.
Okay.
Now, refrigeration is great
Yeah.
for slowing down bacterial growth, but it doesn't kill the botulinum toxin.
Oh.
So the toxin can still be present in food, even if it looks and smells okay.
So even if it seems fine,
Right.
it could still be harboring that toxin.
It could.
That's really good to know.
Yeah.
Any other myths we should address?
One more. A lot of people think that heating food
Yeah.
always destroys the toxin, while heat can inactivate botulinum toxin.
Okay.
It needs to be heated to a rolling boil
Okay.
for at least 10 minutes
Wow.
to guarantee that that toxin is completely destroyed.
So it's not just about heating it up, it's about heating it to a high enough temperature
Correct.
for a long enough time.
Exactly.
It sounds like we really need to be vigilant about food safety,
It is.
especially when it comes to potential sources of botulism.
You're absolutely right. Refrigeration and heating are important tools, but they're not foolproof.
Yeah.
Knowing the facts and following safe food handling practices is the best way to protect yourself and your family.
All right, so we've covered a lot of ground here. Debunking myths about botulism, exploring the different ways it can affect people. But there's a whole other layer to this topic that I think we need to address. It's a little unsettling, but it's important to be aware of the darker side of botulinum toxin.
Are you talking about its potential as a bioweapon?
Exactly. It's a chilling thought, but it's a reality we need to discuss.
It's not a pleasant topic,
No.
but it's an important one.
So in the next part of our deep dive, we'll delve into the world of bioterrorism and explore the role botulinum toxin could play in it. Stay tuned.
Welcome back.
So we just finished talking about the different ways that people can get botulism, but now we have to talk about something a little bit darker.
Yeah, the potential use of botulinum toxin as a bioweapon.
Right. When I was researching this deep dive, I have to admit, I went down a little bit of a rabbit hole,
It's easy to do.
learning about, the history of this and, the potential impact of such an attack.
Understandably so. It's a very, the idea of botulinum toxin being weaponized is frightening.
Yeah.
It's something that intelligence agencies and health organizations around the world take very seriously.
So let's unpack this a little bit.
Yeah.
Why is botulinum toxin considered such a potent bioweapon? What makes it so dangerous in this context?
Well, there are a few things. First and foremost is its potency.
Okay.
As we've discussed, botulinum toxin is one of the deadliest substances known to science. A tiny amount can cause widespread paralysis and even death.
And it's not like there's a visible warning sign.
Exactly. It's odorless, colorless, and tasteless.
Right.
It's virtually undetectable
Yeah.
without specialized equipment,
Mm.
which makes it incredibly difficult to identify in the environment or in a potential attack scenario.
Yeah.
This makes it a very challenging threat to respond to.
So you're saying even if it were used in a malicious way, it might not be immediately obvious.
Right. That's a real concern.
Wow.
The symptoms of botulism might initially be mistaken for something else,
Right.
which would delay diagnosis and treatment.
And by the time it's clear what's happening, the toxin could have already done significant damage.
That's right.
That's a scary thought.
Yeah,
It sounds like early detection is crucial, but incredibly difficult.
very much so.
Are there other factors that make botulinum toxin, attractive as a potential bioweapon?
Another factor is its relative ease of production,
Okay.
at least compared to some other biological weapons.
Mm.
While it still requires specialized knowledge and equipment, the bacteria that produce the toxin are found naturally in the environment.
Oh.
So in theory, someone with malicious intent and the right resources could potentially cultivate these bacteria and extract the toxin.
So it's not something just anyone could whip up in their kitchen,
Right.
but it's also not as technologically challenging as, creating a nuclear weapon.
Right, exactly.
Okay.
And once produced, the toxin can be disseminated in a variety of ways.
Oh, wow.
It could be introduced into food supplies, water systems, or even aerosolized and released into the air.
It seems like there are so many potential points of vulnerability.
There are.
It makes defending against an attack like that really difficult.
It does.
Are there any historical examples of botulinum toxin being used as a weapon?
There have been a few instances, thankfully not on a large scale.
Okay.
During World War II, both the Allied and Axis powers experimented
Wow.
with botulinum toxin as a potential biological weapon.
Oh, really?
They saw its potential for causing mass casualties
Yeah.
and disruption.
It makes sense.
But fortunately, it was never deployed in actual combat.
That's both fascinating and terrifying.
It is.
It's a reminder that this threat isn't new.
No, it's not.
It's been on the radar for a while.
It has.
And more recently, there have been concerns about terrorist groups exploring the use of botulinum toxin.
Yes.
For instance, I vaguely remember reading about the Japanese cult, Shinrikyo,
Yes.
who were responsible for the sarin gas attack on the Tokyo subway.
That's right.
But they also attempted to use botulinum toxin.
Yes, they did on several occasions in the 1990s.
I think I remember that, but weren't their attempts unsuccessful?
Fortunately, yes, their attempts were unsuccessful.
Wow.
But it just highlights the very real danger of botulism as a bioweapon,
Yeah.
even if those large-scale attacks haven't occurred.
It's really chilling to think about how close they came to causing widespread harm.
It is.
Knowing that this threat is still out there, what are we doing to protect ourselves? Are there any systems in place to prevent or respond to a potential attack?
There are several layers of defense in place.
Okay.
Intelligence agencies around the world are constantly monitoring for potential threats and working to disrupt any groups or individuals suspected of developing or acquiring botulinum toxin.
So they're trying to stop an attack before it can even happen.
Exactly. They're using a variety of methods,
Okay.
including surveillance, intelligence gathering, and international cooperation
Wow.
to track down potential threats.
It sounds like a complex and constantly evolving challenge,
is.
given the nature of these threats.
Yeah.
What about on the public health front? What measures are in place to detect an attack if one were to occur?
Public health officials are also playing a crucial role.
Okay.
They have sophisticated surveillance systems in place to detect unusual patterns of illness that might indicate a bioterrorism attack.
So they're looking for anything out of the ordinary.
Exactly.
Like a sudden spike in botulism cases.
That's right.
That can't be explained by the usual causes.
Precisely. They're analyzing data from hospitals, clinics, and labs,
Wow.
looking for any red flags that might suggest a deliberate release of botulinum toxin.
That makes sense. Early detection seems key to containing an outbreak.
It is?
But what happens if an attack does occur? What are the options for treatment?
In the unfortunate event of an attack, there are stockpiles of antitoxin available to treat those who have been exposed.
Okay.
And these stockpiles are strategically located around the country to ensure a rapid response in an emergency.
That's reassuring to know.
Yeah.
But we've talked about how the antitoxin can't reverse existing nerve damage.
Right.
What does that mean for people who've been exposed?
Well, you're right. The antitoxin primarily prevents the toxin from causing further damage,
Okay.
but it's still crucial
Yeah.
for minimizing the severity and duration of the illness.
Yeah, okay.
And alongside the antitoxin, supportive care is essential. This might include things like mechanical ventilation to help patients breathe
Right.
if their respiratory muscles are affected.
So it's a combination of stopping the toxin from doing further damage
Right.
and providing care to manage the symptoms while the body recovers.
Exactly. And research is ongoing to develop new and more effective treatments for botulism. Scientists are working on vaccines that could provide long-term immunity
Wow.
and new antitoxins that could potentially reverse some of the nerve damage.
That's encouraging to hear.
It is.
So we've got intelligence agencies working to prevent attacks, public health officials monitoring for outbreaks,
Right.
stockpiles of antitoxin, and research into new treatments.
Yeah,
It sounds like a multi-pronged approach.
it is.
But with all these efforts, does it feel like we're staying ahead of the curve, or is it a constant race against time?
It's definitely a constant challenge.
Yeah.
As we learn more about potential threats and develop countermeasures, those who wish to do harm are also adapting and evolving their tactics.
So it's an ongoing battle,
It is.
and vigilance is crucial.
Absolutely.
But beyond all the fear and the potential danger, I feel like there's another side to this story.
There is.
You know, you mentioned earlier how something harmful in one context can be beneficial in another.
That's a great point. You're picking up on something really crucial here. We've spent a lot of time discussing the negative aspects of botulinum toxin, but there's this remarkable flip side to this story.
Okay.
A story of how this potent substance, when used carefully and in controlled settings, can actually be a powerful tool for good.
Wait, are you saying that this deadly toxin has beneficial uses?
I am. It might seem counterintuitive, but it's true.
That's wild.
So in the next part of our deep dive, we'll explore that world of medical applications for botulinum toxin
Okay.
and how this substance that can cause so much harm can also be harnessed to heal and improve lives.
So we just finished talking about botulinum toxin as a bioweapon, but now we're going to talk about something a little bit, I guess, happier?
Happier, yeah.
It's really hard to wrap my head around how something that's so dangerous can also be beneficial.
It's a real Jekyll and Hyde situation.
Right, it is.
But it really does highlight how, a substance can be both incredibly dangerous
Yeah.
and surprisingly beneficial depending on how it's used.
So let's talk about these beneficial uses.
Right.
How can something that causes paralysis actually be therapeutic?
It all comes down to dosage and targeted application.
Mm.
One of the most well-known medical uses is Botox,
Right.
which, as we touched on earlier, is a purified form of botulinum toxin A, and when it's injected in tiny doses,
Yeah.
it blocks the nerve signals to very specific muscles, causing temporary paralysis.
Botox is very famous for its wrinkle-reducing effects.
It is.
But I think a lot of people don't know that it can also be used to treat other medical conditions.
Well, absolutely. Beyond its cosmetic applications, Botox is used to treat a variety of conditions that are characterized by muscle spasms or overactivity. For example, it's used to treat cervical dystonia, which is a condition that causes painful neck spasms, and blepharospasm, which causes uncontrollable blinking.
So by strategically paralyzing these muscles, it can actually alleviate pain and improve quality of life for people.
Exactly.
That's incredible.
And the applications extend even further. Botulinum toxin is also being used to treat migraines, excessive sweating, and even overactive bladder.
It's really amazing how something that's so potent can be harnessed for such a wide range of medical purposes.
It is.
But I have to ask, are there risks associated with these medical uses?
Of course, You know, any medical intervention comes with potential risks and side effects.
Yeah.
With Botox, the most common side effects are usually pretty mild and localized to the injection site, like bruising or swelling or temporary muscle weakness.
Okay.
But in rare instances, the toxin can spread beyond the intended area,
Oh, okay.
which could potentially cause more widespread paralysis.
So it's really important to make sure these procedures are being performed by, qualified healthcare professionals.
Absolutely. Proper dosage and administration techniques are paramount
Right.
for safety and effectiveness.
Yeah.
It's also essential for patients to be fully informed about the potential risks and benefits.
Yeah.
And to disclose any relevant medical history or medications they're taking just to minimize the chances of complications.
It sounds like really open communication between the doctor and the patient is super important in this context. Okay. Well, we've come full circle. We started by talking about the dangers of botulism, and now we're ending on kind of a more positive note. It's really a complex and fascinating story.
It really is. It highlights that dual nature of scientific discoveries. Something that can be incredibly destructive can also hold immense potential for healing and improving lives.
I think that's a great way to sum it up.
Yeah.
So we've explored the origins of botulinum toxin, its mechanisms, its potential for both harm and good, and all this ongoing research.
Right.
It's really amazing to see how our understanding of this complex substance is always evolving.
Yeah, we went from fear to fascination, hopefully.
Right.
A deeper appreciation for the complexities of the microbial world and the delicate balance between risk and benefit in scientific advancement.
I think that's a great takeaway for our listeners. So until our next deep dive, stay curious, keep learning, and thanks for joining us.